In 2009, the American Cancer Society projected that an estimated 28,500 Americans will learn they have oral cancer. Nearly 1 out of 5 of those diagnosed will die. The best way to defend yourself against oral cancer is to find lesions early by seeing your dentist for a regular exam that includes Sapphire Plus lesion detection.
I'm Cynthia Payne, and I live in Chesapeake, Virginia. I'm a wife and mother, and I stay at home and take care of my 2 girls. I found a sore on the underside of my tongue, and I went to my dentist, and he said that it should have healed within 2 weeks.
The site itself was a small white lesion, nothing out of the ordinary, but it looked just different enough that I wasn't comfortable just letting it go.
Sapphire Plus lesion detection helps your dentist better discover harmful oral lesions early. Your dentist will use Sapphire Plus lesion detection to shine a safe blue light into your mouth while looking through a special scope to see if there are any abnormalities. When the blue light reacts with oral tissue, normal tissue appears green, while abnormal tissue appears dark, allowing your dentist to see areas of potential concern, even issues occurring below the surface that haven't revealed any symptoms. The dentist can then take photographs of the lesion with a digital camera, which greatly aids specialists in diagnosis and treatment should anything be discovered. It also helps the dentist monitor and compare any conditions for future exams.
So I decided to do a brush biopsy, send it off. It came back with some atypical epithelial cells. At that point, I referred her to an oral surgeon for a scalpel biopsy.
And that came back cancerous.
There are several risk factors to be aware of. Of course, tobacco use will increase the chances of getting oral cancer, as will frequent alcohol consumption. Oral cancer has a higher incidence in men than women, and there is a significant increase in risk of developing oral cancer after age 45. In addition, prolonged exposure to sunlight without proper protection can cause cancer of the lip. Human papillomavirus, a sexually transmitted infection, has been linked to oral cancer, even in young, non-smoking individuals who consume low levels of alcohol. An unhealthy diet with inadequate consumption of fruits and vegetables may also increase the risk of getting oral cancer. Even though there are things you can do to reduce the risk of developing oral cancer, according to the American Dental Association, approximately 25% of oral cancer cases have no known risk factors, which is why it's important to get screened even if you take good care of yourself.
The typical profile for oral cancer was an adult male over 40 who smoked and drank.
Because I don't smoke, there was no reason for me to have cancer.
Nowadays, you're seeing the atypical ones, the females and the young adults.
So I called my twin sister, and of course she started crying. She was just very scared for me. We didn't tell my girls until a few days before surgery. They were very scared. Just nothing like this has happened in our family. It was very traumatic for them. He said yes, we would have to do surgery to remove it, and he said that he would remove around the sore area. He took out a lot of the underside of my tongue.
Sapphire Plus lesion detection also aids oral surgeons in the removal of abnormal tissue. That's because Sapphire Plus shows the clinician the entire lesion, even below the surface, and considerably reduces the chances of leaving dangerous tissue behind to cause further harm.
It's much better than when I first was able to start talking. I talked without moving my tongue at all.
At this point, everything is perfect. The cancer was removed by the ENT. Early detection is key. Survival rate is only 50% if you don't catch it early.
According to the National Institute of Dental and Craniofacial Research, oral cancer discovered in a localized stage or before it is spread has a 5-year relative survival rate of 82%. Once it spreads to nearby organs, the survival rate drops to 53%. If it has spread to distant organs, the rate of survival is drastically reduced to only 28%. That's why early detection is so important. There are many reasons to get an annual oral cancer screening that includes Sapphire Plus lesion detection. Most important, early detection is a key factor in producing the most favorable treatment outcomes, including saving lives. Sapphire Plus lesion detection has been clinically proven to identify oral lesions that are not apparent under traditional methods of examination. It helps the dentist, specialist, or surgeon ensure greater accuracy in diagnosis and treatment. Insurance coverage may be available. Ask your dentist or insurance provider if coverage is available. Plus, the procedure is painless, takes only a few minutes during a routine checkup, and is inexpensive.
If you find that you have a sore lesion in your mouth that's not healing, you should go to your dentist and let him check things out.
If you catch a cancer early enough, you can save your life.
Ask your dentist about a screening that includes Sapphire Plus lesion detection today. It could save your life.